Hello, Happy New Year, and welcome to our first Inside CRCA of 2017. I'm your host, Melissa Buffalo, and today we are with Dr. Puumala and Dr. Hanson, both with the Methodology Core here at CRCA. And our reason for interviewing these two ladies is Dr. Puumala is stepping down as director and going part-time, and Dr. Hanson will be stepping in full-time. So we just wanted to get some questions out and just kind of ask about their transition and any last words Dr. Puumala has. So welcome, ladies. Let me give a little bit about you. So Dr. Puumala earned a PhD in epidemiology from the University of Minnesota. Her research focuses on reproductive, perinatal, and pediatric epidemiology. Her main interests are in prenatal exposure assessment, DNA methylation, and disease development, and pediatric health disparities. Her current research project focuses on emergency department use and care in American Indian children. The study aims to more fully understand and characterize the patterns of ED use and care for American Indian children in the upper Midwest and develop interventions to address issues that are unexplored to date. Dr. Hanson earned a PhD in community and behavioral health from the University of Iowa. She is currently the PI on NIH-funded research studies that use community-based participatory research with American Indian tribes to develop, implement, and evaluate alcohol-exposed pregnancy interventions. For the past 12 years, Dr. Hanson has directed and evaluated multiple projects within American Indian communities focused on maternal child health and has published both qualitative and quantitative data related to women's health and wellness, including prevention of alcohol-exposed pregnancies and fetal alcohol syndrome. So let me start with Dr. Hanson. How has your background prepared you for this role, and any plans or goals you have with Methodology Core and the work you do with our communities?
Sure, that's a great question. Well, I just want to start by saying I'm very excited for this opportunity to work within the Methodology Core, and I'm stepping into some big shoes, so I'm very excited again. So I've worked, like you said, I've worked for the past 12 years with American Indian communities on a variety of health topics, mainly women's health. I've also worked a lot with evaluation and qualitative research, and so have led a lot of evaluation projects, and we have an entire evaluation core with our center that I've worked within. So I feel like this is a great opportunity, like I said, and I'm excited to utilize a lot of my current relationships, develop new relationships with tribal communities, and again, really work on different strengths that the communities have.
Awesome. And Susan, I have two questions for you. So the first one, kind of during your tenure as Methodology Core Director, what are some of the key activities, things you've accomplished in the past?
Well, I think we've accomplished a lot in the last several years. One of the things that we did, and it took longer than we anticipated, but we worked on creating a data management toolkit. So Chad Berger was the main person who developed that toolkit, but it's a really nice guide for really anybody who's interested in storing data and preserving that. So that was a really nice accomplishment, and a lot of our partners have used that toolkit and to help guide some of their data management decisions. The other things that we've done that I've been particularly proud of is we've done some work in thinking about how to measure the global outcomes of the CRCA program. And so we have taken on looking at manuscripts published through the grant, and are in the process of doing a social network analysis. Morgan Nelson is the lead person on that, and we have some collaborators at Augustana who are helping us. And then we also had our health indicators, our analysis, that Jing Zhao led that analysis, looking at a variety of measures over time to see how different aspects of health have changed. And eventually we'll utilize that to look at the impact that the CRCA program has had on health in our communities.
Great. Well, I know you two are not new to working with each other, so any advice you have for Dr. Hanson and any last words you have for Dr. Puumala?
You want me to give you advice first?
I would.
Yeah. I would say this is probably nothing new to you. I mean, doing the work that you've done for so long. But I think the most important thing that we found was trying to be adaptable and trying to think of how we can utilize our skills to meet the needs of the CRCA project. so we've had to change tack a lot of times along the way. But just, we always seem to find at least something that we contribute, or some way that we can work with our partners and with others in Kirk.
And your question was about last words for Susan. I would just say good luck. Again, you've built a wonderful team, and I feel grateful to be able to be a part of it, and I think we'll do our best to try and get you back here someday.
Well, thank you, ladies, for your time. And as you know, we also will see Dr. Puumala at our annual CRCA Summit, so we look forward to seeing you then. And thank you. We'll see you on our next edition of Inside CRCA. Have a great day.